what I want to do is just outline for you the details, and some of it will be pretty technical, of the $50 million of reductions and transfers or the savings that we're announcing this afternoon. So if you remember the last couple of days of the legislative session, the veto session, the budget and tax profiles that they were using assumed $50 million of savings or reductions, transfers in their profile, in the state general fund profile. Within that $50 million of assumptions, that then led to a $87 million ending balance for this fiscal year that started last July 1st. And if the $50 million were not done, then that would be $50 million less than that $87 million. And then on the last day, they passed a bill or a piece of legislation that expanded the governor's allotment authority. Historically or traditionally, the governor has the ability, when the state general fund is projected to be below zero, to make targeted reductions and basically do anything reductions that he so chooses, except for debt service, to get back up to zero. And when the state general fund is projected to be between $0 and $100 million for the fiscal year, then the statutory requirement by law is to make an across-the-board reduction, excluding debt service. So what the legislature did in the last day of the session was they passed an allotment authority legislation that gave him expanded authority and basically gave him the same authority that he traditionally had when the fund was below zero, to do that up to $100 million of cuts. And what it did accept or carve out was K through 12, debt service, and capers. So those three things were excluded. So the $50 million of savings were assumed, and the authority was provided to make up to $100 million of changes or adjustments. So with that, we needed to find those and decided to work with agencies and my staff to do this towards or as soon as possible, instead of waiting halfway through the fiscal year or months into the fiscal year, so agencies and others and stakeholders could plan accordingly. And we have done that, and that's what we're announcing, or what I'm announcing here this afternoon. And the reductions that we'll announce are what's being implemented without changing or touching K through 12, higher ed, capers, and debt service. I do want to take a minute to thank my staff at the Division of the Budget and also the agency staff that were involved in this effort over the last several weeks for the time and intensive effort they took to work with us on finding these savings and transfers and the things that I'll announce here in a minute. A link to the information and to the summary of what I'll go through here in detail here in a minute is on our Division of Budget website at budget.ks.gov as of now. So, Eileen, have you distributed?
No, I can do that right now.
Handout. So we'll go ahead and pass out the details of what we are going to be doing. I apologize that it's on one page and
Pretty small.
probably not big enough font, but we did want to put it all on one page.
Let me just
While we're distributing those, it would have been easier. Some of you have opined that for us to go in and do an across-the-board cut, but we chose not to do that because that would place Medicaid services, correction services, and some of the other services for the vulnerable at impact of this. So we did decide to go in and try to do very targeted changes or adjustments. So let me go through this. The total of what we are going to be reducing or transferring is $62.6 million. Again, the legislation that was passed assumed $50 million, but gave us authority to do up to $100 million. I'm going to go through this line by line, and there is a description on the handout that you have. And again, apologize, it's probably maybe a little bit more technical than what you'd like. On the first one is a reduction from the Kansas Department of Health and Environment State Children's Health Insurance Program, or SCHIP for short, and it is in the amount of $17.65 million. So this is the largest item of a reduction. This does not lead to any sort of expenditure reduction or major change in the program. The timing of this was pretty fortunate in that we were notified in the last couple of days of June that we're going to receive additional federal match from the state and federal partnership of a program. So we're receiving $17.65 million more in fiscal year 16 in federal money, which allows us to offset and reduce the state general fund and fee funds by that same amount. The second item that you'll note is also from KDHE with an item called Hospital Provider Assessment. This is in the amount of $4 million. There is a program that hospitals pay into based on their inpatient revenue from 2010 that generates $47 million for the state that we then use to leverage additional federal money. And then with that total amount of money is then paid out to certain types of healthcare providers like hospitals, doctors, and others. The level of disbursements that are going out as a result of that have increased over the last couple of years to where it is greater than the amount of money that we have coming in through the assessment. The actuarial projections that we have is by $4 million. So we will be reducing this program by $4 million. This will not impact hospital payments. There is a panel that is statutorily required to make recommendations to the legislature, and they will be set to do that by February 15th as to whether to decrease the disbursements going out, increase the tax or the assessment that hospitals pay, or some variation of those two things. The third item is the Department of Children and Families reduced what's called their KEYS maintenance costs, which is a new eligibility system. Due to the delayed implementation, it allows us to reduce those costs by $500,000. The next one is a minor item in Department of Administration with the rehab and repair and operations budget that will be reduced by $200,000. Within the Department of Revenue, we're going to be implementing this fiscal year various policy changes that will allow us to reduce their state general fund by $1 million. Most of that is from moving from legacy information technology or IT systems to web-based systems that have occurred, as well as some internal efficiencies that they have found. So that totals $1 million. The next one that you'll note is from what's called the Commission on Veteran Affairs. The Commission operates, among other things, to veterans homes or retirement centers, aging services for veterans. Because they are receiving more Medicaid and Medicare federal money over the last couple of years, we're able to go and offset their state general fund appropriation by $1.2 million. This will not change the level of expenditures that they are receiving. Again, it's offsetting additional federal money. The next item is from Department for Aging and Disability Services from the Physical Disability Waiting List, which has approximately 1,200 people currently on it. There was $1 million that was added this fiscal year for new waiting list money for this program for home and community-based services. And over the last few weeks, the agency KDADS has determined that they can make offers to all persons with disabilities that are currently on the waiting list without the additional $1 million. The next item is called the Meyer building delay, also for KDADS, which affects Larned State Hospitals for $500,000. And this is because of slower than anticipated census trends at one of our Larned State Hospital units. We're able to delay opening a new unit from January to July. The next item is to the Department of Corrections for reducing graduated sanctions caseload for $1 million. And the reason for this is the agency has had a decrease in juvenile caseloads over the last couple of years that allows them to make $1 million in reductions in this grant funding. The next item is also Department of Corrections and is from an excess balance in the Community Corrections Fund of $1.1 million and comes from a grant and program that they've been working on the last year or two, and money they had set aside for community corrections and supervised individuals that have not come to fruition. The next item is Department of Agriculture for $150,000 from vacant positions, and I did assure them, Martin Hobber, that they still will be inspecting meat. inside joke, sorry. The next item is Historical Society. Because of other funds they are receiving, we're offsetting their state general funds by $800,000. The next one is through the Kansas Bureau of Investigation. They receive an annual appropriation of $250,000 for meth lab cleanup, and they only use, this last year they only expended about $190,000 of that, so we're going to sweep the balance that they have in that fund. And then there are several items that lapse into one called reappropriations. Every year in the appropriations or budget bill, agencies are allowed within certain budget or line items to reappropriate money from 15 to 16 fiscal year. And we are, much like we do every year, lapsing a certain portion of those, in this case a total of $9.1 million. So this does not affect their 2016 budget or appropriation. This is lapsing unspent money from last year in these cases. So those totals for expenditure reductions total $38.4 million between all those things. The next section is revenue transfers. Some of these are considered much of what I've gone over the last couple minutes of transferring balances, excess balances. Others are expenditure reductions. The reason they show up in this section of revenue transfers is these are non-state general fund budgets or accounts. And the way that the ledger works for this is we reduce the expenditure authority in these accounts or agencies and then transfer that to the revenue for the state general fund. So it shows up as a revenue transfer. So the first one is to KDOT and the State Highway Fund of $8 million. This comes from the ability of the agency of implementing several efficiencies last year to the tune of about over $8 million that we're able to transfer to the state general fund, mainly from lower than expected staffing costs, also because of a milder winter than expected, lower salt costs, those kind of things. This will not and did not affect the T-Works programs, unlike some of the other transfers that were made or planned for in the budget. The next one is Department of Children and Families and a program or revenue fund called Children's Initiative Fund or CIF. And we're lapsing funds because of what's in the budget bill and what it calls for of $2.8 million. This program ended, or the appropriation ended for it in 2015 for a program called Lexia, which is a reading program. The next one is the Board of Regents Performance Incentive Grant, and this is something that actually we're capturing that the governor line item vetoed when he signed the budget bill in June, so it's a change that's already been made. The Board of Regents have indicated that the appropriation they received in fiscal year 15 will be enough to cover them for a couple of years. The next two are from the Department of Commerce. The first one from a program called the EDIF, which is a special revenue fund, economic development. The legislature reduced funds or reduced the line items in this particular budget or fund, and we are transferring the balance over to the state general fund. The next one is a program called the Innovative Growth Program, which is the excess, or they are making some changes to grants that go out to the former program called K-Tech of $1.2 million. The next one also is in the Department of Commerce through a program that was called Disability Employment Incentive Program, and this is for $859,000 for the year, and this is a result of the agency being able to leverage additional state and federal dollars for the program. The next one is similar to what I went over with the $9 million lapsed appropriations for expenditures, lapsing appropriations that are in non-state general fund agencies of $2.2 million. And this is mainly coming from lapsing expenditures in our Rural Opportunity Zones or ROZ program. The projections for this is they do have enough money to carry them forward for the projections that they have. The next one is for a program called KDAS for a fee fund transfer to state general fund, and this is a program within the state general, or with Home and Community-Based Services, or HCBS program for short, and a reconciliation with providers. They did basically a recoupment they did of providers of $1 million over the last year or two. Wildlife Parks and Tourism is going to be transferring $500,000 from various balances within their agency. Then the last item is several fee-funded boards and commissions will be reduced with their expenditure authority and then transferring excess balances they have, $3.8 million to the state general fund. And the reason for doing this is they have balances that are sufficient enough to cover their operating expenditures for fiscal years 16 and 17. So the total of those revenue transfers are $24.1 million. Again, the total is $62.6 million. So that is, again, in probably more technical detail than what you wanted. Again, the version of what we handed out here to the media and those here in this room is on the Division of Budget website at budget.ks.gov. With all of those changes, with those $62.26 million, to alter what was sent and written about by several last week through the Kansas Legislative Research Department, or KLRD profile, on July 20th, that had a projected ending balance of $67 million. This would bring the projected ending balance up to $78 million. With that, we will continue to monitor the revenue situation closely over the next several months, and as we always do, continue to look for efficiencies and other things that we can do within the budget, so with state agencies, to continue to have a structurally balanced budget for fiscal year 2016.